So normally after we've done our range of motion, active, passive, and resisted, typically we'll do our ligament stress test next. But if as part of your observation, you note that they have quite a bit of swelling in the knee, you know you're gonna have to do your intracapsular swelling tests. And if your intracapsular swelling tests are positive, then you're just gonna focus on ACL, PCL, and meniscus testing. So there's 2 intracapsular swelling tests that we're going to learn. The first is called swipe test, and for it you're taking the back of your hands, you're going to swipe up on the medial side of their knee, and you're going to swipe down on the lateral side. Now, intracapsular swelling, because of that extra knee joint capsule on the front of the knee that allows knee flexion, the swelling tends to accumulate at the front of the knee. And so with the intracapsular swelling test, we're taking the back of our hand and we're trying to force that swelling away from the medial side of the knee and over towards the lateral side of the knee. And then when we swipe down, we look for a little bubble of swelling to push back over to the medial side of the knee. If we see that bubble of swelling push back over, then that would be a positive intracapsular swelling test. The next intracapsular swelling test is patellar compression. So for it, we're going to wrap our thumbs and fingers around the perimeter of the patella, and we're just going to push straight down. And you want to make sure that what you perceive to be motion is not just simply the knee extending. So we can have them on a firm surface to do this. And when we push down, normally if they don't have a lot of swelling, it's a hard end feel. If you imagine like your fingers and thumbs wrapped around a bar of soap on a counter and you're pushing straight down, that's what it's typically going to feel like. But if they have that intracapsular swelling and it accumulates in behind the patella, when we push down, it's going to be more soft, squishy end feel. You imagine like the bar of soap being on a wet sponge on the counter. That's what it's going to feel like as you push down on the wet sponge.
With this video, I'll just demonstrate myself doing swipe test, one of our intracapsular swelling tests, on a patient of mine. He used to be a competitive trampolinist, and we suspect that he had a partial ACL tear while he was competing, and he's since retired from competing and does a lot of coaching, but he aggravated his knee while doing yoga. He was in a single leg pose and he felt his whole knee shift. And so when we started our assessment, just looking at the knees, there appeared to be noticeable swelling around the front of the right knee. So I decided to do the swipe test. So you'll see me swiping up the medial side of his knee with the back of my hands and swiping down on the lateral side, and we're looking for a bubble of swelling to push over to the medial side of the knee. It'll show it twice, so especially on the second time you might notice that bubble of swelling pushing back over to the medial side of the knee. So that would be a positive.